Being able to know exactly how much a prescription is going to cost when it's prescribed just doesn't happen today, and that leads to some serious financial hardships for a lot of people.
I had to call the patient and let the patient know that this medication, which is vital for her health, is going to have a copay of $453. It was devastating. She's on a limited income, she lives with her family, and I had to tell her how much her copay was. You know what she said? I'm going to probably start crying. But she said, what choice do I have?
But it's not just the patients that are hit in the pocketbook. The pharmacist loses whenever a patient doesn't pick up a prescription because of a high copay. This is especially true on so-called maintenance medications.
I am anticipating that I'm going to have to refill that in the next month, which means that I need to pay for that medication to come to my pharmacy, which is an inventory cost. But if it just sits on my shelf, patient never comes in, I can't just return that medication back to my wholesaler because I've already opened it, I have to wait for it to expire.
Assembly Bill 2352 by Nazarian is designed to fix these serious problems.
So this bill requires PBMs to provide the data necessary to providers at the time when the providers are consulting with their patients. And so that consultation allows the patient to know exactly what they're getting when they go into the pharmacy.
Not just the type of medication, but the cost of the medication. If the medication cost is too high for the patient, they'll know at the doctor's office, which will allow for the doctor and patient to figure out an alternative medication that is just as effective medically and more affordable.
It empowers the doctor to be able to give the best information to their patients. It allows the patient to receive the best information, having also been made aware of what the costs are for the various medications that they can have access to for the purposes that they need.
This dynamic doesn't just strengthen the patient-doctor relationship, it strengthens the entire care team-patient relationship, including the pharmacist.
And that way when they come to the pharmacy, I'm not having a conversation with them about what their cost of the medication is. I'm having a conversation with them about why they should take the medication. That's a very different dynamic than what we currently have right now.